Historically, cannabis was not seen as a drug of dependence. However, there is now a growing body of research evidence indicating there is a clinically significant withdrawal syndrome associated with long-term cannabis use in some regular users, particularly those who have a higher severity of dependence. Cannabis withdrawal typically begins within 24 hours of last cannabis intake and usually peaks 1 to 4 days later. The most commonly reported symptoms of cannabis withdrawal are sleep disturbances, including insomnia, strange dreams and nightmares. Other common signs and symptoms include irritability, anger, anxiety, depression, and reduced appetite. As yet, there are no effective pharmacological treatments to help reduce cannabis withdrawal symptoms or to block the effects of cannabis, although studies are underway. There are a number of psychosocial treatment options available to help cannabis-dependent people cut down or quit. Research studies have shown that even a single session with a counsellor can assist those dependent on cannabis to reduce their level of use and improve well-being. The intensity of treatment depends on the individual circumstances. Some people respond to general education and information about managing craving and high-risk situations for relapse. In some circumstances, treatment may include inpatient management for cannabis withdrawal and rehabilitation.
Many young people that come here come because of their cannabis use. In fact, currently 35% of our clients are experiencing issues around cannabis. All of our counsellors here use cognitive behavioural therapy. We know that this is effective in terms of our clients reducing their cannabis use, but also in terms of looking at their psychosocial functioning and dealing with other cannabis-related issues. What we notice when clients present here with difficulties around their cannabis use is often they present with other problems. So they may present because they're having difficulties at school, they may have withdrawn from school, they may be isolating themselves from friends, could be family problems, and often some symptoms of mental health issues such as mild anxiety, depression, those types of things. The approach that we use here is very much around motivational interviewing. So we're really allowing young people to explore their cannabis use, look at the pros and cons in terms of what's happening at the moment around that, identify high-risk situations, how to avoid high-risk situations, and really exploring are there alternative ways to what's happening now. So we're really focusing on the cannabis-related issues rather than the drug itself.
Cannabis is a widely used drug that is still shrouded in much controversy. Since the 1960s, the drug has increased in popularity, and community opinion continues to be polarized about its relative harm. Many still believe the drug poses little or no harm to physical and emotional health, despite the fact there is now considerable research evidence that use of cannabis, particularly amongst the young and those with a predisposition to mental health disorders, can be devastating. While most people who experiment with cannabis will not go on to develop significant problems, it is worthwhile noting that today, most Australians accessing treatment for an illicit drug problem report that drug to be cannabis.
I mean, from what we know about the developing brain, in particularly the development that goes on through adolescence, anything you can do to postpone heavy use to later on in the teenage years is a very, very useful intervention.
I think it's really important that workers are aware that cannabis use at this age can lead to problems down the track, not just for cannabis use, but for other life problems, employment, criminal involvement and so forth.
As the manager of a youth organisation, I think it's important that services out there are really aware of where young people are in terms of their readiness to change.
I think the sector really needs to have cannabis on their agenda more. When they're screening for alcohol use and tobacco use routinely, they should include cannabis in that group. In particular, in the health sector, where people are presenting with respiratory symptoms or with mental health problems or with problems in school, work or relationships, they should more formally assess for the role that cannabis might be playing.
For further information and help about cannabis, call the Cannabis Information Helpline 1800 30 40 50 or visit www.ncpic.org.au.